Hello everyone, welcome to Common Questions Asked in Genetics. In today's class, we will be seeing about one more method of the infertility treatment that is called in vitro fertilization or IVF. About 71% of the assisted reproductive therapy procedures now use in vitro fertilization with the woman's own eggs. An in vitro procedure is one that is performed in the laboratory. Advances in these procedures have dramatically increased the rate of live births. The best candidates for IVF are women with damaged fallopian tubes, and some experts believe it is better option than attempting surgical repair. IVF is also used when infertility is unexplained or when the male partner has the infertility problem. So a typical IVF procedure is as follows. First, the doctor induces superovulation using fertility drugs so that several eggs can be harvested from the ovary before they have been released from the follicles. Higher doses of fertility drugs for subsequent cycles do not appear to add any advantage in women who have a poor response for the first time. Then once the eggs have been harvested, to harvest the eggs, the doctor generally inserts a probe into the vagina and is guided by an ultrasound. Then a needle is used to drain the liquid from the follicles and several eggs are retrieved. Later, the eggs and sperms are combined in a petri dish. Between 48 to 72 hours later, the eggs are fertilized. The resulting embryos, that is the first stage towards the development of the fetus, are then re-implanted into the woman's uterus. It takes about 2 weeks to determine if the process is successful. So the IVF success rates for the first 3 cycles of treatment are about equal. Then they decline modestly for the 4th cycle and drop significantly after the 5th cycle. So here we see an image of the in vitro fertilization. So first the ovaries are stimulated by the drugs that is known as the ovarian hyperstimulation. Later, the eggs are being retrieved or collected with the help of an ultrasound and a tube with the help of a syringe. First, the fluid is drained out and then the eggs are collected from the follicles before its release. And in the meantime, we collect the sperms and prepare them from the male partner. Finally, both the sperm and the egg are incubated in a petri dish and left for 48 to 72 hours. Later, we can see that an embryo has been formed. Then, an embryo transfer is done into the uterus with the help of a syringe and a tube, which is inserted into the uterus. And later, after a few weeks, we will check for the pregnancy test and come to know whether it has been successful or it has failed. In case it has failed after a few weeks, again these steps will be repeated. Okay, so this is about in vitro fertilization. Hope it is clear to you. Thank you.